Hey everyone, and welcome to Visual DepictsMED. You know, if you've ever found yourself just staring at a page in a dense medical textbook feeling totally lost, well, you are in exactly the right place. Our whole mission here is to take those super complex topics in anatomy and physiology and turn them into clear, engaging visual explainers. We want to help you not just ace your exams, but to really, truly get the why behind the what.
So today, we are diving deep into a structure that is absolutely essential for talking, tasting, swallowing, you name it. But its anatomy can be a real headache for students. So get ready, because we're about to demystify it all. This is your complete clinical guide to the tongue's vessels and nerves.
Here's the game plan. We're going to kick things off with a little clinical mystery, just to set the stage. Then, we'll map out the tongue's lifelines, that's its blood supply, and its security system, the lymphatics. After that, we'll dive into the command center, the nerve supply. And finally, we'll put all those puzzle pieces together to solve our mystery and wrap up with a quick quiz to make sure it all sticks. Let's get started.
You know, anatomy isn't just about memorizing a bunch of names. It's really about applying that knowledge. So to see why all these little details are so critical in the real world, let's start with a scenario you might actually see in a clinic.
Okay, imagine this. Your patient comes in with two things going on. First, a painless little ulcer right on the tip of their tongue. Then, about a week later, they feel a new, tender lump right under their chin. So the question is, are these two things related? This is the puzzle we're going to solve today. Just keep those two clues tucked away in the back of your mind as we go through the anatomy.
First things first, let's talk about how the tongue gets its fuel. I mean, it's a hardworking muscle, right? So it needs a really rich, dependable blood supply to keep it going. These are its lifelines.
The whole story of the tongue's blood supply really starts with this major player in the neck, the external carotid artery. The best way to think about it is like it's the main highway for blood that's heading to all the external parts of your head and face.
So coming off that main highway, the external carotid, there's a really important exit ramp. And that is the lingual artery. The name kind of gives it away, right? Lingual means tongue. This artery branches off and heads straight for the tongue, becoming its #1 source of fresh, oxygenated blood. This one vessel is the critical lifeline we're focusing on.
All right, so just like arteries bring all the good stuff in, you need a totally separate system to clear out waste and, more importantly, to patrol for threats like bacteria. This is the tongue's security system, its lymphatic drainage. And I'm telling you, understanding this network is absolutely crucial for tracking how infections and even cancers can spread.
Now here's a key concept. The tongue isn't just one big zone when it comes to lymphatics. We have to divide it into 3 distinct regions. You've got the very tip, then the main body, which we call the anterior 2/3, and finally the base, or the posterior 1/3. Where a problem starts totally determines where it might show up next.
Okay, these lymph node groups are so clinically important, and they love to ask about them on exams, so we need an easy way to remember them. I've got a great mnemonic for you. My mandible chews. Simple, right? The M in my is for the submental nodes. The M in mandible is for the submandibular nodes. And the C in chews stands for the deep cervical nodes. Now let's trace the actual pathways.
Let's start right at the very front, the tip of the tongue. The lymph from this specific area drains directly to those submental nodes, which are located right under your chin. But here's a super important detail. This drainage is bilateral. That means it goes to the nodes on both the left and the right sides.
Okay, now for the rest of the front part of the tongue, that big anterior 2/3 section. This area primarily drains to the submandibular nodes, which you'd find just under your jawline. Now, some of the central parts can also cross over and drain to the submental nodes. From there, the lymph fluid keeps traveling downward toward the deep cervical nodes. And last but not least, we have the posterior 1/3, the very back of the tongue. This area plays by its own rules. It actually bypasses those nodes we just talked about and drains directly into the upper deep cervical chain. These are lymph nodes that are located deeper in the neck, running alongside the major blood vessels.
All right, we've got the plumbing and the security system down. Now it's time to get into the really complex stuff, the wiring. This is the command and control system. The tongue's nerve supply handles everything from feeling your coffee is too hot to tasting that delicious dessert, and of course, all the movements for speaking.
So let's take a look at the nerve map of the tongue's surface. We're going to focus first on the anterior 2/3. And what you'll notice right away is that this area has 2 different nerves, doing 2 very different jobs, one for general feeling and one for taste.
For that anterior 2/3, just remember this: 2 nerves, 2 jobs.
General sensation, so things like touch, pain, temperature, that's all handled by the trigeminal nerve, which is cranial nerve 5. But taste? Those signals travel on a completely different highway, the facial nerve, cranial nerve 7. Now, the posterior 1/3 is actually way simpler. It's one nerve, two jobs. The glossopharyngeal nerve, cranial nerve 9, handles both general sensation and taste for the back of the tongue.
So what about actually moving the tongue? Well, this part is much more straightforward, thank goodness. The vast majority of the tongue's muscles, both intrinsic and extrinsic, are controlled by one powerhouse nerve, the hypoglossal nerve, cranial nerve 12. A cool clinical test is to ask a patient to stick their tongue out. If that nerve is damaged on one side, the tongue will actually point towards the weak side. Now, there is always an exception, right? And in this case, it's the palatoglossus muscle, which gets its nerve supply from the vagus nerve, cranial nerve 10.
Okay, we have gone through the arteries, the lymphatics, and the nerves. We have all the pieces of the puzzle. Now it's time to put it all together, go back to our patient, and finally crack this case.
So, let's bring our mystery back to the forefront. A painless ulcer on the very tip of the tongue and a tender, swollen lump right under the chin. Now that you know the anatomy, can you see the connection? What's the link?
And this summary table just lays it all out perfectly. Look at that top row. The region is the tip of the tongue. And where does it drain its lymph? You got it, directly to the submental nodes. So, the link is the lymphatic drainage. That ulcer, which was probably a little infection, allowed bacteria to travel through the lymphatic vessels from the tip of the tongue straight to that submental lymph node under the chin. That's what caused it to get all swollen and tender. See? This is a perfect example of why knowing these pathways is so incredibly important in a clinical setting.
Now that you've officially cracked the case, let's make sure that knowledge is locked in nice and tight with a few practice questions. You ready?
Question 1 is up. A lesion on the posterior 1/3 of the tongue would most likely metastasize to which group of lymph nodes first? Is it A, submental, B, submandibular, C, upper deep cervical, or D, lower deep cervical? Go ahead and pause here if you want a second to think it over.
And the correct answer is C, the upper deep cervical nodes. You have to remember, that posterior third is different. It drains directly to that deeper group, completely bypassing the submental and submandibular nodes. Let's do question 2. Loss of general sensation, so we're talking touch and pain, on the anterior 2/3 of the tongue would indicate damage to which cranial nerve? Is it A, facial, B, trigeminal, C, glossopharyngeal, or D, hypoglossal? Take a moment.
The answer is B, the trigeminal nerve. This is a classic trick question. Don't forget, the facial nerve is all about taste in this area, but general sensation is the job of the trigeminal nerve.
Okay, last question. The lymph from the anterior 2/3 of the tongue drains into which nodes? Is it A, submental only, B, submandibular only, C, both submental and submandibular, or D, deep cervical only?
The best answer here is C. While it does primarily drain to the submandibular nodes, there's also that crossover drainage to the submental nodes, especially from the central parts, which makes C the most complete and correct answer. And there you have it, the clinical anatomy of the tongue, completely decoded. I really hope this visual approach helped you connect the dots between all those structures and why they matter so much. If it did, do me a huge favor and hit that like button, and be sure to subscribe to Visual Depicts MED so you don't miss our next explainer. We actually build our content based on what you want to see, so drop a comment below and let us know what topic you want us to tackle next. Thanks so much for watching, and happy studying.